Welcome everyone to Alliance Chicago and Health Choice Network's webinar series on COVID-19. Today, we're going back to school. The webinar will be starting shortly. Our webinar will be starting shortly, but first, please join us in our word cloud. Take out your cell phone and type in the line 22333, and then put in the message line COVID-19 Heroes. You'll be able to join our word cloud for today's webinar. And today's word cloud is, what is your favorite thing about back to school season? Type in 22333, put in COVID-19 Heroes in the text line, and then let us know what is your favorite thing about going back to school. The webinar will be starting shortly. The webinar will be starting shortly, but let's pay attention to National Health Center Week starting next week. We are forever grateful for our community healthcare heroes. So please join us in today's webinar, Back to School. Will be starting shortly. And once again, please join us in our interactive word cloud. Take out your cell phone, put in 22333 in the line, and put in COVID-19 Heroes, and join our word cloud of today's webinar. What is your favorite thing about the back to school season? Looks like football and snacks is winning. We want to hear from you. Join our poll. Save the date, November 4th. Alliance Chicago, and Health Choice Network are having a virtual educational conference together, but better together, innovating now for tomorrow. Save the date, November 4th. Health Choice Network and Alliance Chicago in action. Today's webinar is Back to School in the Time of COVID-19. The webinar will be starting shortly. Please join us in our interactive word cloud. It's coming up. We want to know, what is your favorite thing about the back to school season? You can put in more than one word. And here's where we need to hear from you in our live word cloud for today. Take out your cell phone, type in 22333, put in COVID-19 heroes. We want to hear, what is your favorite thing about back to school? Football, snacks, new clothes, teachers. We want to hear from you. The webinar will be starting shortly. Our webinar will be starting shortly, but we want you to save the date. Innovating together now for tomorrow. Alliance Chicago and Health Choice Networks virtual educational conference together starting this fall, November 4th. So the webinar will be starting shortly. Health Choice Network and Alliance Chicago in action. Today's webinar is on back to school. We're going to just wait a couple more minutes for a few more people to join, and we'll get started. One moment. So welcome everybody to today's word cloud for today's webinar. If you want to have one last entry into our word cloud for today, put in your cell phone 22333 and put in COVID-19 heroes to join us. And what is your favorite thing about back to school? And we have heard from many people, but not everybody. We have several hundred people on today's webinar. So we have teachers, new clothes, football and snacks, holiday, sharpened pencils, library, new books, book bags, buying things, education, cookies, kids' excitement, and friends. So welcome everybody. Today's COVID-19 webinar is all about back to school. And as we advance the slide, we are going to today hear from a number of different speakers across the country. First, we're going to hear from our CEOs of both Health Choice Network and Alliance Chicago, who will give us some insight into what's been going on since our last webinar, but even more importantly, what's going on in the epicenter of some areas across the country, such as South Florida. Then we're going to hear from the Chicago Public Schools. We'll hear about all of the challenges that have gone into the decision of how do we educate our children this year. Then we're going to hear from 4 of our star health centers from both Health Choice Network and Alliance Chicago. Borinquen, Heartland, Pinellas, and Erie. We'll hear from their staff about how they are managing our back to school season. And first, let's hear from our CEO of Health Choice Network, Alex Ramillo. Alex, are you with us today?
Good afternoon, Tim. Can you hear me okay?
Perfectly. Take it away, Alex.
Thank you. First of all, thank you everyone for joining us today. We've enjoyed our 11th webinar series, working very closely with our sister network, Alliance Chicago. We appreciate all the work that our healthcare heroes have been doing during this crazy time in the pandemic. And now it's schools reopening. We are also very worried and focused on how we can serve our community. Next slide. Go ahead to the next slide. So just some facts from South Florida. We now have the tagline of the fact that Florida can't vote, and also that we are now the epicenter. Two titles we don't really appreciate here in South Florida, but I wanted to share with you the numbers as of this morning. You can see the numbers in the top 4 counties. Those numbers continue to go up, and they're equivalent to our discussion today because they're also the 4th, 6th, 8th, and 10th largest school districts in the country. Health Choice Network has a long history with school-based health. This past year, we saw about 74,000 unique patients in our school-based health centers. And we also built the first electronic health record interface for our Miami-Dade Public Schools partnership with the Children's Trust and Miami-Dade Public Schools. So it's very interesting, and I look forward to all the conversations we're going to have today with our expert panelists from our health centers and from Dr. Rockman, because we are very concerned with the size and the volume of these large school-based systems. Next slide. As you can see, many of the parents are also concerned. The latest ABC polls shows that only 44% said they'll be willing to send their kids back to school in the fall, despite 59 of them saying they were concerned about the children. And for those of you who saw news last night, we saw some of those schools reopening and the children automatically taking off their masks and taking pictures together. And that is of high concern for us, primarily because in South Florida, we're a very large retirement community. And those children may weather the storm of the pandemic and COVID-19, but bringing that virus home to the elderly and their parents is our biggest concern right now, since our hospitals are reporting 115% utilization as of this morning. Next slide. And as I was doing my research for this presentation, I also wanted to see what the other 10 largest school districts are doing. So this is just information for you that I felt that I did some research on what each of those 10 largest U.S. districts are doing. And you can see about 100% of them are doing some level of online, and many of them had to change to plan B and C just to accommodate, because the governor here in South Florida has said that each county would have to be under 10%. And you'll see in a couple slides there that we are far from that 10% threshold to allow children to go back into school. The Archdiocese of Miami and the Catholic school system is also following suit with Miami-Dade Public Schools here in South Florida. Next slide. So I did want to share some information because Health Choice Network does work very closely with our behavioral healthcare centers and other organizations, not-for-profit, that are partners with our FQHCs in South Florida. And some of the information that we're receiving from the CDC and from others are coming to fruition. We're seeing a lot of children having issues at home during this past first wave, as they're calling it. And we can see some of these attributes in our children today. I have two daughters at home. One is a 20-year-old in her junior year of college, and one is going into her 5th grade. And we've been able to see how the impact when they heard that their school is going to be virtual, they were both in tears because they really were looking forward to going back to some level of normalcy. And for my youngest daughter that has trouble focusing, the online focus for us has been almost impossible to manage. With 5th grade coming up, I am highly concerned as a parent on where we go next, specifically with this pandemic. Next slide. And we also partner with a lot of faith-based organizations and not-for-profit organizations. FAME is just one of those organizations we partner with. We were just able to help them distribute all the clear masks. That handsome young man in the corner happens to be my godson. And my godson was born with a lot of physical issues. And as he interacts with other children, it's been critical for us to prepare him for the challenges ahead. And as he prepares over the next couple of years to deal with several surgeries, his social interaction with other children, other parents, and other teachers has been critical for us, because we are preparing him to be secure with his own body and realized that there are other obstacles that we weren't prepared for, such as bullying and jokes and distasteful name calling. We weren't prepared for a pandemic. So as a God's father to a 2-year-old, one of the things that we were looking for with FAME was to figure out how we can help him continue his social interaction, which is going to be critical for his success as he grows older. And these clear masks has also been a huge savings, specifically in the social process, because we also know that 55% of communication is visual, especially with children as they develop. And so we appreciate the partnership with FAME and with ClearMask. ClearMask is actually donating for every one mask purchased, one mask is donated. So we've been very fortunate to get these masks out to most of the ELCs across the state. Next slide. And as you know, I'm a data guy, so it's important because if we have to get under 10%, you can see where the positive percentiles here across the counties as of this month, all the way raising from 20% all the way down to 14%, with a 14.9% average across the 4 largest public school districts here in South Florida. And I have the pleasure of serving as the board chair of the largest residential foster care program in the state. And I will tell you that we focus on children going back to school and the challenges between the parents and the education. But we're dealing with, on the foster care program, several other challenges. Number one is the domestic environment has grown severe, and placing foster children has been almost impossible. Many of the foster parents cannot open their home because they're either self-quarantining or self-isolating. Other parents that should have additional support in regards to the parental rights is not receiving that today. So we're seeing the children arrive with much more severe cases of lack of education, access to computers, et cetera. The fundraising has been impacted. So everything we raise right now, where our school drive to get school supply, has been impacted. The PPE and over-the-counter medications, just like ourselves at home, had impacts around PPE and over-the-counter drugs. The entire foster care program has been impacted. And because we were not able to administer and activate our volunteer network, many of the staff is working 24/7 to keep our foster children engaged, because usually we give them out to summer camps, after school programs, and homework labs. And unfortunately, all those have been on hold. So imagine the foster care program with a large amount of foster kids in a residential treatment center that can't go outside. So you can imagine if I'm struggling with 2 children, which are pretty much grown up, can you imagine having 50 or 80 foster care children trying to figure out what to do on a daily basis? So just other challenges that we're experiencing that are going to have direct impact in our education. Next slide. These are just some data that I thought was important. 70% of the children in Miami-Dade County and 65% in Broward County are either on free or reduced meals. So now, even though we're going full online, we're still having to provide those meals for those parents. Those children rely on breakfast and lunch from the school board. So that's been a major push for Miami-Dade and Broward County, is to continue that free and reduced lunch offering for parents and be able to pick up those breakfast and lunch for our children. The second item that I'm really concerned about is the digital inequity. I will tell you that even in urban and rural areas here in South Florida, we have lack of access to broadband, technology, and even the educator support for children at home has been lacking. So we are really concerned about that and the impact to our health centers as far as those children coming in for additional proactive care and their wellness visits and their immunizations. We're having challenges in online education for our aided need. We have a large population of aided need children, and the teachers are being hired after school to be able to help those children at home for those parents that can afford that. Not to mention, we have the most active hurricane season since 2005 here in South Florida, and our partners in the Carolinas are now experiencing all the way up to Boston with Hurricane Tropical Storm Isaias. And we are very concerned about this disruption a large hurricane can have, not only on our supply chain, but also on testing and results. And as our physicians remind us all the time, we do have the upcoming fall flu season. We want to be prepared. So we are communicating actively to our school board and to our school partners in regards to how important it's going to be to make sure our children are vaccinated. So that's it from me here in South Florida. I can tell you that we had a bunch of new cases, and we're happy that we have 3 days of continuous drop for 3 days straight to 8,000, but those numbers are still well above the 810 percentile. So I look forward to hearing from all the pediatricians and expertise at the FQHCs on how we can navigate further and get our children back to school and educating. Thank you, Tim.
Great. Thank you, Alex. And thank you very much for all of the work that you and Health Choice Network does for the children of South Florida. And always, as emergency preparedness season with hurricanes is here, you're on double duty. And along with all the HN staff, know how hard you work to get PPE and everything else for the health centers of Health Choice Network. So again, thank you very much. And now, as we turn ourselves to the Midwest and Chicago, we're going to hear from Dr. Fred Rockman. So Fred, are you with us today? We're going to check Fred's audio here. Hold on one moment. Fred, how are you?
Great.
Able to hear us?
How about now?
Perfectly, Fred. Welcome.
Great. I'm glad to be with everyone today. This is one of the few bright spots in a very, very challenging set of circumstances that we find ourselves in. You know, as I thought of sharing with you, I couldn't help but have my perspective be colored by the fact that I'm a pediatrician, and so this topic is especially meaningful to me. Could you go to the next slide? So I think we have to recognize that we're having this discussion in the context of a global health crisis of epic proportions, just about unprecedented. We have to go back more than 100 years to find anything remotely comparable. And even that, the flu of 1918, is not entirely comparable because, of course, the virus behaves very differently. And we're in an age where the degree of mobility and travel is very different from what it is then. So we really are together exploring totally uncharted territory. And as you can see from this map, we need to approach any of these conversations with complete humility because, look, we are the leaders in the world in terms of the devastation that the virus is bringing to us. Next slide. So we all hoped, I think, as we went along, that this was going to be time limited. There was like some jubilation at the beginning where you saw we did do a fairly good job early on with strict measures of beginning to contain the spread. But as you can see, as we began to try to come out of that, we've experienced a concomitant increase in the spread of the virus. And what's challenging of this, if we looked at a map of the United States, the experience is very variable, which makes these national level conversations very difficult. There are areas of the country that are almost completely untouched, where you heard Alex speak about an area of the country that is quite the opposite. And if you look at the bottom and see the very, very concerning trends in a few geographies, you see that in these hot spots, there certainly is there are ominous signs and reminders that this indeed is still not behind us at all. Next slide. Local here in Chicago, as an example of the differences in the country, we were jubilant because we thought, well, we were great. And our mayor was even like excluding people, those of you from other parts of the country, thinking that, you know, we were riding well. And as you can see over the last week, things have turned as they can, and numbers are beginning to be more concerning, both in terms of the positivity rates, the increases in cases, and unfortunately a downturn in our ability to keep up with the required level of testing for surveillance. Next slide. So as we have the conversation around children and back to school, it's very similar to the way we think of these things in general, where we're on the one side balancing the risks of the disease itself, and on the other side balancing the impact of our measures to try to contain the disease. So a recent study, this is actually local to Chicago at our own children's hospital, increasing evidence that although children appear to be less impacted clinically, there is increasing evidence that they can be important carriers of the disease, and indeed some suggestion that younger children actually are especially fertile harbors of the virus. And therefore, because of their activity, because often we don't have them wearing masks, et cetera, could become actually a very, very key source of spread of the infection. The next slide. But on the other side, as we say, next slide, please. Yep. Evidence looking at what happened in China and other places, and beginning to be observations here, that of course the experience of the stress of the infection, the change in our daily routines, and the social isolation all have negative impacts on our children. And so we are in this tension, like, what do we do? How do we sort of balance the risks of both sides, the risk of the disease itself and the pandemic, and the risks of the measures to try to contain? Next slide, please. So like anything, I think we're in a balancing act. Early on, when we were in this sort of acute phase, we did these very, very strict measures and strict isolation. And as you could see, it did have a dramatic effect on containing the virus. But I think we're all realizing that if we're looking at a year or more, we can't sustain that level. And so people have begun to thinking of a sort of a harm reduction approach. And this comes from the Texas Medical Association. Hope you've seen this as an example of guiding people to make calculated choices about what we do and what our activities are, and to consider, make our decisions based on a risk profile, so that we're balancing the limitations of our activities against what risk it poses to fuel the spread of the infection. Next slide, please. So looking ahead, we're all looking ahead. What's happening? What's ahead of us? Well, I hate to say, but there are some bleak predictions. This is a little infographic that came from the World Economic Forum, where they surveyed globally more than 300 risk analysts, and looked at what we can expect going forward as the sort of the additional gifts of the virus. And you can see, if you just keep hitting the forward, we've got some arrows to help you relate to the graphic. Yeah, we can see that there will be more bankruptcies and consolidation. And I want to just say our health centers are not immune to that. High unemployment, more restrictions on travel and movement, increased automation-related unemployment. So particularly our patients in communities where jobs are of a nature where they're more easily replaced by automation, they are at greater risk. And obviously people in the service industry, which are many of our patient service industries, are at great risk. Geopolitical exploitations. Of course, an event like this is ripe for political leaders to take advantage of it, not necessarily for the public good. Erosion of civil liberties in attempts to deal with the virus, both positive and negative attempts. Definitely threats on mental health and impacts of stress. And I would add to mental health, we know that mental health is linked to physical health. And then worsening and deepening of inequalities and social division. So a lot ahead for us to be contemplating as we're with our more holistic views of health at community health centers. Next slide, please. So as we contemplate that and contemplate, quote, going back to school, these are some of the things that we're aware of as we've been tracking with all of you, how our care is evolving, are things that we need to do to respond. First of all, clearly, increased use of virtual care is in our future. meeting the increased demand for mental health and substance abuse disorder. We're aware that we're accumulating a backlog of folks that are now behind on chronic disease and preventive care, and we're going to have to catch up and figure out ways to keep up, especially as those things become more challenging for the reasons that we just discussed. We've always struggled to address social determinants. If we contemplate the things on that previous slide, we can understand why, if we're really taking on addressing health, that becomes even more critical that we rise to the occasion to find new ways to do that. And the events of the last few months have also included a reminder of how we have neglected the more silent, chronic public health threat of discrimination and social inequity. And it's imperative that we address that, because this current, again, as we saw in the previous slide, the current situation threatens to worsen those. And finally, we do need to develop strategies to cope with financial challenges ahead on every level for the patients we serve, but also our financial organizations. Just a reminder, Scott Gottlieb early on, sort of when people were being thoughtful and looking proactively at what we needed our public health system to do, looked at what we needed to do to control future spread other than distancing, better data, improvement in our social and state and local public health infrastructures, as well as treatment. Next slide. And we're certainly far from being able to do that. So we're really thoughtful here. You could just keep hitting forward for me to unveil the whole slide. We're really thoughtful that there are, in order to deal with this, whoops, a little bit too far, just back, okay, that there is a relationship between what we traditionally looked at doing from an individual healthcare perspective, so in the COVID realm, testing and counseling services for individuals who seek that from us, and healthcare for COVID-impacted individuals, with what public health functions call for, which is surveillance and contact tracing and prevention. And I think if you ponder this slide for just a second, or I think we tried to address this on previous webinars, there's a clear opportunity for us at health centers to lean forward, think in a larger context, think as a system in how to link these activities and be part of a solution that is more comprehensive. Next slide, please. This is really most timely. Our mission at Alliance has really been to think through how do we use all the assets at our disposal to deliberately promote that linkage at all those levels. And so we've been attempting with all of you to be using the various levers in our capabilities to do that, ranging from the collaborations that we're doing here to create learning community through to technology-related assets like data analytics and informatics and interoperability. Next slide. Well, when we think about it, this slide, which I always show, I have to, that talks about the networks and what we do as networks, it should be so incredibly apropos to everyone at this moment in time. We have got to be working as a system at health centers. A time for us to be looking out only for our individual health center welfare is really not now. We must think as a system. Next slide. So back with my pediatrician hat on again, I think through what is it that we need to do, as we look forward, particularly with respect to the topic at hand, like supporting our children in the back to school or not back to school. One of the key things that we know is either way we go, we've got to have tools that we're making available for our care teams, for our parents, about dealing with stress, because underneath that is going to be a key health. We know that's a key health issue. There are just a couple examples here of some simple approaches. And we think, having some simple frameworks like this at our fingertips are going to be useful for all of us, for our care teams, for our patients. Next slide, please. So this is just a slide here for you for resources coming from the Association for Adolescent and Child Psychiatrists with a bunch of specific resources aimed at equipping people, at both care providers and parents and teachers to be able to work with children more competently. Next slide. So I just wanted to end by causing for us to reflect that everyone on this call, we're not just caretakers of others, we're also caretakers of our families. And as such, this, metaphor of needing to be taking care of ourselves is really, really critical. And I'm watching the impact that all of this stress has on us as human beings. So my plea is that in order to be having these conversations and thinking through how to take care of children and our communities, we must be putting attention to ourselves. Next slide and final slide. And so just a few thoughts here in that that we don't try to hold ourselves up as being perfect or having it all worked out, but that we practice openness. That turns out to be more helpful than pretending to be on top of it all. Being aware ourselves of the signs of stress in ourselves and our colleagues. Being a role model and caretaking others. That there's a lot of evidence that it's helpful in stress to be taking care of others. That is the good news for all of us on this call. Watching media and watching fake news. And we have a very, very important role to play as community leaders in this. Scheduling family time, and I would even call this extended family because we are all family. So scheduling time that we're care and feeding our support structures, having in place structures, and this last one, seeking help if needed. So with that, I just want to again say how glad I am in this to be part of this collaboration that we're part of, and just put in this pitch. I love that our conference theme is Better Together, Innovating Now for Tomorrow. It's a great theme as we think about this because we are having to reinvent ourselves every day in the midst of what we're dealing with. Thanks, Tim.
Great. Thank you, Fred. Thank you for your words of wisdom. Thank you for all that data and thanking you to remind us to take care of ourselves. So that's great. And so on behalf of Alliance Chicago and Health Choice Network, we want to thank everybody for putting on this webinar, but then also this conference. So please save the date. And just as a reminder, all of these slides will be available to all registrants. We'll email out the slides along with the recording of today's webinar. Also with that, I just want to, when you look at the slides and get Fred's slides, look at that gradation of risk for COVID-19. The least risk is opening the mail, and the greatest risk is going to a bar. So with the going back to school season and political season, opening the mail is the lowest risk. To make sure that you mail your ballot back and vote on November 3rd. And then November 4th, we will have a very happy conference. So please take the time to vote. So now we're going to actually have everybody take out your cell phone, and we are going to have one more poll. And if you put in your, hold on one second, there we go. If you, in your cell phone, type in 22333 for our interactive polling question. So today's interactive polling question is, using your cell phone, in your community, has the school system gone 100% online, 100% in person, or blended learning? So again, it's A, B, or C for one of those three answers. Using your cell phone, in the to line, put in 22333, and then put in the text line COVID-19 heroes, and then we'll be able to see the live interactive polling. We have about 300 individuals right now eligible to join in our polling. So we're going to leave it open for just one moment as we see the live results come in. So this is using your cell phone. Put 22333 in the message in the to line, and the text line put in COVID-19 heroes, and then you'll get a response back from that, and you'll be able to join in our poll of A is 100% online, B is 100% in person, or C is blended learning. And as you can see, as people are putting in their responses to our live poll, the numbers are going up and down. But so far, and Stephanie, why don't we close the poll in about 5 seconds and we'll lock in those numbers. And this is just like voting, right? It's never done until somebody calls it, maybe the Associated Press. So Stephanie, why don't we close the poll now? And so we have 44%, so they're doing 100% online. 3% of their communities are having 100% in person. And the winner is blended learning. 53% of your community schools are going to be in blended learning. So thank you very much for that interactive poll. And it's going to lead us into our very first speaker, who is from the Chicago Public School System, Dr. Kenneth Fox, who is the Chief Health Officer, but more importantly, he's a pediatrician and a good friend. So Dr. Fox, can you hear us okay?
Yes, I can, Tim. Thank you very much. And good afternoon, everybody. This is, without a doubt, to be the best part of my day. It feels like I'm with my tribe here with you, and I appreciate that, especially in moments like this one. I'm here to talk for about 15 minutes or so on back to school from my perspective as the Chief Health Officer of Chicago Public Schools. And I think we can go to the next slide, please. To begin, we considered 3 models. I mean, the first was to learn at school full time. Scratch that one. Then learn at home full time. And what we proposed in the original draft framework for reopening schools was a hybrid model, which was, part in person and part remote. Let's go to the next slide, please. This is just a look at the hybrid model that we originally proposed. This was about 2 weeks ago. We released the draft framework, and this hybrid model, public health conditions at that time indicated that this would be safe for us to try. And essentially it broke down in this way. We would arrange the district into shifts, and let's look at shift A. They would have attended in person Monday and Tuesday, done remote learning with a live teacher and the rest of their classmates on Wednesday, and then did this learn at home on Thursday and Friday, and we flipped it for shift B. That was the concept. Let's go to the next one, please. Thank you. So we were thinking about this in terms of different groups, having different needs in a sense. For different groups, we recommended different learning models. We thought the learn at school might be best for the youngest set, certainly pre-K and then kids in cluster programs. Learn at home would be the focus for 11th and 12th graders, and the hybrid model would have applied to K through 10. Let's go to the next slide, please. Another important aspect of the plan, the draft plan, was to organize the schools into pods. So within a school, you'd have different pods of kids, and so these are fixed groups, and this would basically limit the mingling that happens at schools, and would also facilitate contact tracing should that need to happen. We because of the pod structure, we'd know who was with whom, and we could potentially set down a pod if a case occurred in a pod, set down the pod for quarantine if that were necessary without having to shut down the entire school. Next slide, please. So we did imagine we implement a number of health protocols, and these are depicted in the slide. We were going to require a daily symptom screener, that we wanted to keep the sick from the well, and those who became ill during the school day would go to something we call the care room. This is essentially a waiting room for kids who, should not be in school, who were waiting for their parents to pick them up. It's not a nursing office, not a clinic, it's not an instructional space, but just a place, a temporary holding place for students until parents came to pick them up. We're to require face coverings for everybody. The pods we talked about, this would facilitate social distancing within the schools of 6 feet per person, and also facilitate contact tracing. We're after aggressive hand hygiene and enhanced cleaning and disinfecting protocols as well. Next slide. In general, we were pushing the following messages. In a sense, this was going to require a kind of cultural change at CPS. You don't go to school or work if you're feeling sick. Wear face coverings whenever you're out in public, including at schools. Maintain social distancing, and you limit your contact with others. And the hand washing, another piece of that, a change that we're professing or advocating. Let's go to the next one. So we thought Chicago was in a kind of unique position with regard to the pandemic. Here's a picture of our pandemic curve, nicely flattened, as you could see, really a thing of beauty in the public health gaze. And what we talked about was reopening and closing decisions being based on the data. Let's go to the next slide. That our focus really has been on average daily cases. This is a 7-day rolling average. And in our view, the public health conditions in Chicago, we thought would safely allow for a hybrid model, daily cases being in the 200 to 400 range. But that we always said that our plan would change as conditions change. As the public health situation evolved, so would our plan evolve. Let's go to the next one. In order to pull this off, we had to get started early on a number of items. We're talking about purchases on a grand scale. Really, we're making some investments that would support a hybrid model. And this meant purchasing over 1 million reusable cloth face coverings, installing tens of thousands of hand sanitizer dispensers, and of course the sanitizer to go in them, containers of wipes, 22,000 infrared thermometers. Can you imagine? Hospital grade disinfectant sprayers, so extra equipment, PPE, it just goes on and on and on, extra custodians, etc. So we were really investing in this idea. Public health conditions certainly matter. The curve matters, but let's go to the next slide. Politics also matters in Chicago, as we have seen. And, clearly average daily cases were creeping up. We're now at about 277, our positivity rate about 4.8%. So better than in some places. And at the moment, perhaps safe enough to give the hybrid model a chance. But that chance really faced some resistance. There was resistance on the part of some parents who felt uncomfortable with the plan. And the workforce as well, I must say, came out strongly against the plan. And that's why I do say, let's go to the next one. and this I believe will be the final slide, that the politics of this situation mattered as well. And we'll continue to engage them and to keep our eye on the public health conditions and see where this takes us. As you probably know, the announcement today was made to pivot from the hybrid model to a remote learning model. This clearly has profound implications for child health and for families and for all the stakeholders involved. But we're keeping our eye on these issues and these metrics and our situation, and we hope that one day we'll all be together again, that we will enjoy at least some measure of school as we once knew it. And I think I'm going to leave things right there. Thank you so much for inviting me.
Great. Thank you so much, Dr. Fox. We really appreciate all of the work that you're doing with the Chicago Public Schools. We know that this is a challenging time. We know that politics matter in this, and all of our parents and community are very invested in this. There's only one brief question that came through the chat. When you were talking about the pods and students in pods, approximately how many students would be in one pod?
Right. Our idea was that a pod is 15 students.
Great. Well, again, thank you, Dr. Fox. We appreciate everything that you're doing.
My pleasure.
So next, we're going to turn to 4 health centers who have volunteered to talk to us today about efforts that they're doing within their health center. So first, we're going to go back to South Florida and Borinquen Medical Centers. And I think Dr. Gracia is going to start us off. Deborah, are you with us?
I am, Tim. How are you?
Great.
Hello, everyone. Thank you for joining us in this very important topic. My name is Dr. Deborah Gracia, and I will have 2 additional presenters with me. I'm the Chief Medical Officer at Borinquen Healthcare Center, and I will also have one of my pediatricians, Dr. Nizar Dowla, and one of my pediatric assistants. So Borinquen Healthcare Center was started in 1972 by a group of Puerto Rican community organizers. We are a federally qualified healthcare center serving about 44,000 patients. That's what our numbers last year. In terms of our services, we provide primary care services, dental behavior health services, community outreach, and we have a large substance abuse program as well. We also have our school health program, which has nurses, social workers, and a nurse practitioner, and we serve 31 public schools in the Miami-Dade County area. At the schools, the services we provide are behavior health assessments. We provide health education for the students, first aid, chronic disease, medication management, immunization, and oral health screenings. Next slide.
So, hi, my name's Nizar Dowla. I'm one of the pediatricians at Borinquen. So, as one of our previous speakers had mentioned, Miami-Dade County Public Schools is one of the largest districts in the U.S. with over 345,000 students and 40,000 adult staff. In late July, our parents were surveyed about whether they preferred online or in-person education for the coming year, and basically it was 50-50. But as of now, Miami-Dade County and most of the state of Florida is in phase 1 of our reopening plans, which means that we will be online only. There are going to be additional resources and programs for our students who need individual educational plans and for our English as a second language learners, which is a big portion of our population here in Miami. The goal is for mobile devices to be provided to every K through 12 student, although of course this has its difficulties as well. And the county has also set up over 3,400 Wi-Fi hotspots in both rural and urban areas. The school facilities will still be used to prepare meals for eligible students for free and reduced breakfast and lunch. But however, we will not be having any athletic activities as long as schools are closed. And club and extracurricular activities for our older students will still be attempted on Zoom or other online platforms. Next slide, please. So the plan, at least according to the county and our health and education colleagues here, is to move from an online only to a hybrid system based on certain grading criteria, as was mentioned previously, having a overall positive test rate less than 10% with a goal of 3%. We're around 14, well actually 20 here in Miami-Dade County, and a steady reduction in hospitalizations, ICU occupancy, and total number of cases, which again, we are nowhere near right now. However, when attending school in person in the future, face coverings will be required for students and staff, and I put that in red letters since we know, unfortunately, mask wearing has become a bit of a political issue. However, for our students and staff, they will be required. We're going to have hand sanitizing stations. We're going to promote social distancing and also isolate students and staff who have symptoms and have a contact tracing protocol in place. Next slide, please. And so this final slide for anybody offline, if you are interested in some of the guidance that was used to make these decisions, these have links to various guiding documents that were used by the county. Next slide, please.
So our school health program at Borinquen Medical Center is following Miami-Dade Public Schools plans for staff to return to schools, clinic sites. In addition, we're also following what the Children's Trust, our contract to provide care for the Miami-Dade County Public Schools is through the Children's Trust. So as far as Borinquen is concerned, we're providing all the necessary PPE and physical barriers for staff, the plastic desk barriers, and at the time when we were still planning on sending children back to school, at least on a part-time basis, we talked about providing COVID testing for symptomatic students with parent consent. So that was one of the things that we were discussing. We were also planning on providing telemedicine services for students at 8 of our sites with school nurses on site, and either with the nurse practitioner providing guidance to the school nurse, or one of our pediatricians on site providing guidance to the school nurse via telemedicine services. And of course, we have always, even throughout the pandemic and even while schools were closed, we provided mental health services via telemedicine to all our students that were on our program. Next slide.
So I'm Adrienne, I'm a pediatric PA. Many of our parents have been torn between their children's mental and physical health. They want to send them back to school, but they're not sure if it's safe. And the parents will ask us, if it's your child, what would you do? So recently, the American Academy of Pediatrics released some guidelines about starting school. And actually, unfortunately, there's been a lot of misinterpretation over the past few weeks by politicians and media. But basically, the guidelines say that to recommend that students are physically present in school when it is safe. So this just recognizes that school is important for cognitive, physical, social, and emotional development. And also the schools help ensure food security, physical safety, and racial equity. However, we must balance this with local infection rates, the state of the community to protect the overall health of the child and the community. And another major concern parents have had is the effect of coronavirus on children, especially for the rare multi-system inflammatory syndrome. So we have been at Borinquen calling patients that have been tested for coronavirus, whether they're positive or negative, in the last month. And this just ensures adequate evaluation and follow-up of the children at risk, and it provides reassurance and education to the parents. Next slide. Again, the AAP guidelines are intended to get children in school when it's safe. But it's also recognizing that there's no policy or set of actions that can completely eliminate the risk of COVID-19. It's all about mitigation. So it's going to take a lot of teamwork between the medical providers, the parents, the children, the teachers, and the government. But when the transition does start, depending on where you're at, the recommendation is for physical distancing, whether that's 3 or 6 feet apart, depending on what's feasible, and definitely facial covering. And it's important that we start teaching the children at home, that parents are teaching the children at home right now, that face coverings need to be worn anytime you're not in your home or with your immediate family, and also hand hygiene. And again, working with them at home, constantly wash your hands, don't touch your face, and wash before and after meals. So that way when they start school, they'll be already in the habit. And then of course, there's still the option for online learning if the above are not feasible or the local infection rate is high. Next slide.
And so in kind of conclusion for our part of the presentation, what is the recommendation that we are giving to our parents and our families each day in and out in the office? So first and foremost, staying up to date with well child visits and immunizations. As one of our previous speakers had alluded, some of our, out of a well-born fear, they weren't coming to the clinic kind of more in March and April. And now we're trying to use this back to school time to and the summertime to try to catch up on that chronic disease management, vaccines, well child, school physicals, sports physicals, etc. We are also recommending telehealth visits when possible. We have a lot of patients who need a referral for a subspecialist or to review lab results, and those don't necessarily mean that the patient needs to be physically present, and so we can do that via video telemedicine. We recommend, as always, a healthy, well-balanced diet, maintaining adequate sleep based on your age, and getting exercise every day, and really focusing on the mental health of our patients, of the kids, but also their parents, since we know that we need, our parents' ability to care for the kids depends on their mental health as well. And finally, kind of interestingly, a lot of our parents and patients have been asking about integrative or other strategies other than medicine in order to help boost their immunity. Some of the resources from the Institute for Functional Medicine are listed in a link there for anyone who downloads the PowerPoint afterward. But some things that do have scientific evidence include elderberry, probiotics, vitamins A, C, and D, and zinc, of course, in age-appropriate doses. And so anybody who's interested in that can review the link in the slide listed there. Next slide, please. And so with that, we'd like to say thank you for including us in our presentation. We hope that everyone on the call is staying safe, and wish you and your family well.
Thank you very much.
Great.
Stay safe.
Thank you, Dr. Gracia, and thank you to the Borinquen team. You guys are healthcare heroes. So as we move on to our next health center, we're going to move back to Chicago, and we're going to hear from Heartland Health Centers. So Elizabeth, are you with us today?
Yeah, I'm here. Can you hear me okay?
Perfectly.
Great. I'm just going to start by saying I live right near a train, so apologies if there's any background noise. Hopefully there's no train going by this afternoon. So my name is Liz. I'm over at Heartland Health Centers in Chicago. We are a federally qualified center here in Chicago. We have 17 total health centers. I believe we see around 27,000 patients a year. 7 of our clinics are school-based health centers, 4 high schools, 3 elementary. And our model is a provider, a medical assistant, a front desk person, a social worker. Some of our schools have dental as well. And our model during the typical school year is, we serve just the student body, and we try to take a school as population approach and really try to manage the population needs as a whole. And with that being said, only one of our school-based health centers has an outside door, and so that I guess sort of led into the decision to really only see the student body. Next slide. As you can probably tell, I made these slides before the plan for CPS was released, as we just heard from Dr. Fox. But back in March, that is when Chicago entered the shelter in place, and that's when our schools and our school-based health centers closed. We initially planned for temporary reassignments of all of our staff. We sent them out to our community health centers and figured this would be a week or 2. And here we are, I guess, what is it, 4 or 5 months later. So like I said, we rapidly redeployed to our community health centers. We were able to implement telehealth across our community health centers. So our school-based health providers were providing telehealth to school-based patients, community patients, and we're also instrumental in implementing our drive-through and community-based COVID testing. And then we this summer have been planning for our reopening of schools, which of course we know will be online at this point. So during this whole time, the past couple of months, our team has been working really hard to make sure students know how to access us. We've done many text campaigns. We've done many phone call campaigns, calling our students that have certain healthcare needs, like our asthmatics, our diabetics. We've tried to find innovative ways to reach the students, whether that means, asking one of the teachers if we can present during their class time, either virtual class time. We've held some parent webinars. We've tapped into our youth advisory councils to find out how do the students want to reach us? What are the ways that they're interested in accessing our care? And so, we've really found that this is a time for us to be creative and to really, think outside of the box. Next slide, please. This summer, when we have been thinking about returning to school, which we know will happen at some point, and so I think any of the planning that we're doing now will pay off in the future. We of course, have many considerations to think about. With the environment, we really made sure to think about, with each of our 7 schools, what are the things that we need to make this a safe place for our patients and our staff members? And does that mean, physically removing chairs from the waiting room, adding physical barriers and signs, things like that? Of course, right now with remote learning, the clinical workflows is really, the most important thing that we're working on innovating right now. We know that students are used to just walking into the school-based health center and having their needs met when they want them. And in this new telehealth world, it's a totally different ballgame. Students, if they don't have that access in that same way, we've found that they're less inclined to seek us out. So we're really trying to focus our efforts right now in this remote learning world on how can we make sure students know how to reach us when they need us, and how can we make sure that we're meeting the needs of the students who really need us the most. And so, of course, like I said, these slides were made before, we really knew what was going on this year, but things that we're really trying to think about right now are how can we tap into the teachers and the staff of the school to make sure that they know to reach out to us if they have concerns about students? Can we create really clear workflows so that they understand how to refer students for us for medical needs, behavioral health needs, or maybe, there's some social services we can help look into. What about immunizations? How are we going to make sure that our students from, our little ones all the way up through our high schoolers are getting their immunizations that they need? We're so used to, in the school-based health center, being able to work with the school and working on medical compliance kind of in a large way in the fall. And if we don't have that access to the students, how can we innovate in that way? So, thinking about things like outside immunization fairs and we're working on ways to, figure this out with the school community. Making sure that we're able to meet the needs of the students where they're at right now. And of course, things that, clinically, things that we're really thinking about are, who are the students that, we would have had access to that no longer have healthcare access. We know a lot of adolescents are not seeking out care on their own. And so especially, like I was saying before, our asthmatics and other students that have chronic illnesses that are untreated or undertreated right now, we're used to really focusing on risk assessments for our students, and we're not able to do that right now. So how can we focus on that? Of course, right now we're all really thinking about how can we increase our screenings for different social and behavioral health issues. And I think another thing that's really important with our high school seniors, one thing that we've always found really important is to emphasize the transition of care for them. Once you leave high school, once you no longer have a school-based health center, how can you access care? And so now in this new telehealth world, trying to emphasize that with our students. So when we do return back to school, obviously, a few operational management things we'll want to focus on as well are, supply chain. I heard, the presenter down in South Florida with the hurricanes that, there's supply chain issues there. So that's something all of us have to think about. What happens if one of our staff members gets COVID? Are we able to kind of have other folks sub in? So yeah, I think every day things are changing, of course, and I think the name of the game this year is flexibility. We're planning on providing all of the services that we can for students via telehealth, providing them in-person services at our community health centers when able, and hopefully when the schools are reopened, we will be back in the building and able to serve them in that way as well. And I think that's it.
Great. Thank you so much. It was such a great presentation. We also hope that the schools are able to be open safely and in a healthy way. So thank you so much to you and Heartland and all you do. So again, it's the Chicago, Miami, South Florida connection here. We're not actually going to go to Miami, but we're going to go on the Bay side. And we're going to hear from Dr. Threadgill and Dr. Kelly from Community Health Centers of Pinellas. So are you guys with us?
Yes, we are here.
Great. Take it away.
Excellent. So thank you guys all. Certainly a pleasure to talk and discuss and really hear some of the great ideas that everyone has. I think that our presentation is very similar to a lot that you've heard already. Looking at safety, the worry that a lot of parents feel, a lot of educators feel, and a lot in the community feel about the return to school, and how we best do that. So next slide. So one of the, so as we're thinking about school, we know that in-person school serves a critical role. It provides academic structure and support, community and economic well-being, social and emotional health of our students is supported by in-person schools, and also provisions of a lot of special services such as food programs, special education programs, extracurricular activities, and after-school programs, which really help to support our lifestyle and a lot that goes on in our society. And so I don't think there's a question of if we all had a choice and magically we could make everything all right, would we choose that kids go to school? Absolutely. I don't think that anyone would differ in that in general, right? And so, but looking at this through the eyes of the pandemic, how do we do that in a safe way? Next slide, please. So I work with or sit on an advisory committee with our superintendent here at Pinellas County Schools, as well as several others from our organization, as well as throughout the county, some infectious disease specialists, other community pediatricians, and others from the school. And so, there are certain things that we take into consideration as we're thinking about how do we safely return to school. And so if you look at the World Health Organization, they have a fairly nicely written criteria that says, it is recommended that, the new positive test rate for COVID should be less than 5% average over the 14 days. And so that all sounds really great. And then the CDC has a little more lax in their definition of how do you return to school. And they say, again, of course, you look in your immediate community, but they say reopening should be guided by what's feasible, practical, acceptable, and tailored to the needs of each community. And so it doesn't guide you a lot of times directly. And so you really do have to kind of look at what's going on in your community and how do you best kind of make a decision for what your community needs. We also had in Pinellas County had a parent survey or family survey that was sent out to everyone that said, what's your choice? How would you like to return to school? And the options were in-person school or brick and mortar, or remote learning, or our virtual school, which is the state virtual program. And so in Pinellas County, only about 33% of the families responded to the survey. So not a lot of response, but of those who responded, over 60% chose online learning. The default, however, of the survey is if you did not respond, your choice is in-person school. So at this point, a lot of what we're planning on in Pinellas County is then that 66% of our students will be returning to in-person school. Next slide, please. So what were some of the key considerations that as we're trying to plan a back-to-school strategy and look at how do we make things safe, what are some of the key considerations? Of course, distancing for students and staff. So how do you do that? Is it possible to space desks far enough apart in a classroom? Do you repurpose or use other spaces within the school building, using the gymnasiums or auditoriums as classroom spaces? Can we use outdoor spaces to really try to expand the landscape? Staggering start and end times of school, limiting transitions between classes, particularly in middle and high school, where one student could have 7 classes throughout the day, which certainly does not say anyone is isolated in any way in that frame. So how do you then cohort? A lot of talk about creating pods, so keeping students in a class pod, staggering student arrival and departure times, teachers staying in class, teachers rotating classes while the students stay in a classroom, and then looking at other strategies to reduce transmission, such as face coverings, masks, hand hygiene, high-touch area disinfectants, ventilation, and shared equipment. All these things are kind of things that you have to think about. And it's easy to think of all the things that need to be done, but really the difficult work is how do you implement it, and is it possible to implement? And so as we were trying to determine, is it possible to safely bring kids in, we really tried to look at each of these. How feasible is it really to have these things, to implement these things, and to have these things kind of working in that way? Next slide. Some of the other things, of course, is how do you effectively communicate with staff and students? How do you making sure that everyone is up to date with what's going on? We in healthcare certainly know how quickly things change, and changing processes and protocols sounds easy, but never is. It's a very difficult thing. Making sure that everyone is aware of when we're closed or when we're opened, or are we closed or are we open? And then, of course, thinking ahead of what do you do if we open and we have positive cases? What is the plan? Do we have a protocol in place? How do we safely do that? Do we have staff? What happens when staff members or the principal or assistant principal could potentially have to be isolated? And then do we have the capacity to do contact tracing of our positive cases? Our Department of Health has stepped up to say that they have staffing and that they are able to do so. But, everything has a capacity. And so, as we bring students back into our learning spaces, it's just a concern that we all had to have. So next slide, please. So we were looking at our learning options, and again, they were the brick and mortar remote learning, which was kids are home but have the live classes with their teachers, or our Florida virtuals, which kids are home but they're part of the state program, which is a self-paced curriculum and not within their school. So in Pinellas County, we do have the 3 options available. Students were required to make a selection of what choice they would like. We did decide to, or not we, the superintendent decided to push the school start back to, right now it's August 24th. Our positivity rate in our area is not less than 5% at this time, you know, as the WHO would suggest. And so there is still some contention on whether or not everyone feels it's safe. But we are, based on our most recent data, less than 10% positivity. So we're somewhere around 7% is our most recent information. But moving forward, what the plan is, we elected not to do temperature screening for all students, but did require masks or face covering, which will be provided to all the students. We did postpone most of the contact sports and many other extracurricular activities. There will be symptom screening for all of staff and students daily. Limited seating on school buses, and school nurses have been preparing and for possibilities of sick kids and areas that they could potentially place students in areas of isolation. All of those things have really kind of gone into play, and I don't know that any of us really know what to expect or how to expect. But what we will find out is as school begins on August 24th, you know, really how many of those students will attend, and is that spacing and distancing really going to be effective in keeping down the transmission of the virus. And so we're very hopeful that a lot of those elements are all in place. And so as a county level, those are kind of a lot of the considerations that took place. And, you know, we tried to look at it from several perspectives. And I know that Dr. Kelly is going to talk a bit about how that then impacts us as a pediatrician and as parents on a more personal level. Thank you. Dr. Kelly, you can go for it.
Good afternoon, everyone. Thanks. We've had some great speakers this afternoon. So some of what I have to discuss has already been touched on, but we'll go through what I put together anyway. So next slide, please. I'm just going to talk to you for a few minutes about what I've been doing the last few weeks and just speaking with parents in the office. And, you know, inevitably the discussion moves to this question of, Dr. Kelly, what should I do? I don't know what to do. And so we talk about how there's just no perfect choice right now. The choice of what to do about school weighs heavy on parents. We dread it, we fear it, we're exhausted, we're stressed and anxious. And so I just encourage them to think about not trying to focus on the illusion of there being some one right answer, but instead focus on evaluating and mitigating the risks that exist in both environments or your hybrid environment or whatever your options may be, and assess the benefits that your child may experience in either of those scenarios. There's no one-size-fits-all solution. Every option has a flaw. Every child has different needs, and every family has different needs. And we all may come up with a different decision at the end of the day. Next slide, please. So a lot of what I am going to share with you this afternoon was taken from an article, a really excellent article. I do recommend that you click on the link and read through this. This was actually written by a women's health psychiatrist, but it has some really great content. And so Dr. Lakshman wrote this article about how to talk to parents about handling their anxiety over back to school decisions. And so as I mentioned, focusing on evaluating and mitigating risks. Some things that you can talk to parents about is, as they're thinking about sending their kids to school, you might want to encourage them to talk about the risk reduction strategies that the school is taking. Will they have undergo daily screening like temperatures or symptom check-ins? What's the school's plan to identify and isolate students or staff that arrive to school with symptoms? And then assess the benefits that your child would experience being in an in-person learning environment, their peer interaction, the quality of their educational experience, their ability to receive therapy or additional services, and obviously the ability for parents to maintain employment is super important. Next slide, please. So really the choice is theirs, but I try to help in ways that we can. And Dr. Lakshman's article was excellent in boiling down to these two main points. So first you have to decide what to do for your child's education, and then you have to decide what to do with those uncomfortable feelings that inevitably arise after you have made that decision. Once a decision is made, accept the uncertainty. There's no playbook for COVID-19. Everyone's navigating these uncharted territories together. It's going to feel uncomfortable, and I think we as parents don't like that uncomfortable feeling. As human beings, we don't like that uncomfortable feeling, but we have to stop fighting those uncomfortable feelings and those worries. Worry is normal, and it's natural, and it protects us, and it's super necessary at times. It's when we give in to those unproductive worries that can turn into difficulties and anxieties and true health problems. We also have to commit to be compassionate. And first and foremost, I encourage my parents to be compassionate towards themselves and give themselves permission to not have all the answers. No one does. I don't have all the answers, and I'm your child's pediatrician, so I can tell you, you don't have the answers either. Be compassionate towards the other people that you're interacting with, your school administrators, the teachers, other parents. Not everyone's going to make the same choice as you, and that's okay. Next slide, please. And then you also have to pay attention to your child, so obviously kids are experiencing some letdown in a variety of ways. And this was touched on earlier in the presentation by Alex, but kids can experience any variety of emotions: grief, anxiety, fear, and depression. And so I, of course, encouraging families to check in on their child and asking kids how they're doing with the changes and what's going on. And of course, you can use pediatric symptom checklist and PHQ-2s and all of those things that we use in the clinical setting, but nothing replaces just a simple conversation and checking in about how things are going and encouraging parents to look for those hidden cues sometimes that their child is struggling. My 7-year-old, almost 8-year-old third grader is just in tears every time she thinks about going to school and not being able to hug her friends and and have that closeness that she's used to. And so, we just have to check in with our kids and make sure that they're able to express their emotions, and we can help them work through those uncomfortable feelings together as a family. Next slide. And then I encourage families to find some fun in all of this craziness. So, if your kid is going to in-person learning, or really in general where masks are encouraged and in some states mandated everywhere, help your child pick out their own well-fitting, I want to mention that, well-fitting mask. And these are her favorite colors. Practice wearing masks at home for longer periods of time. It's amazing how much we touch our faces when those masks go on. So families don't often realize that they have to practice that at home. Practice with shorter time periods, working up to longer time periods. If the first day that your kid is really wearing a mask is that first day at school and expected to wear it for 6 or 7 hours, it's not going to go very well. You can make it a game. How long can you go without touching your mask? Of course, we want to teach our children to practice washing hands correctly. I encourage families to find or Google search a favorite 20-second song or make one up, better yet. And of course, we can brainstorm new ways to interact with friends and continue that peer interaction and socialization that's so important. Next slide. And then lastly, I encourage the families to just focus on what matters. Don't forget your family values and the things that are at the core of your being and the things that make you tick. So I encourage families to continue to have some closeness time, some interaction with their immediate family and extended family, again, and sometimes new and exciting ways, more remote and virtual. Don't forget those important family meal times, special one-on-one times with parents. And I ask parents also to think about, what do you want your child to remember about this time? And whatever the answer to that question is, spend some meaningful time making some of those memories. And always we should be putting our energy into what works and what's meaningful for you. Don't spend too much time spinning your wheels and accomplishing nothing and going down the Facebook rabbit hole. Come back, turn it off and come on back to reality. I believe that was my last slide.
Great. Well,
All right. I think that was the end. Thanks, Tim.
Thank you. Thank you so much, Sarah and Dr. Threadgill. That was so fantastic, truly. We will have all of the slides along with that link that from the New York Times article that Dr. Kelly just mentioned. We'll send these out, the slides out with that link in there. I think that was just great. Very, very informative. So our last health center for today's COVID-19 back to school webinar series is from Erie Family Health Centers, and Martha Glenn is going to talk to us about what's going on at Erie with back to school. So Martha, can you hear us?
Yes. Can you hear me?
Yes, perfectly. Take it away, Martha.
Hey, awesome. I'm the site medical director for Erie Family Health Adolescent and School Health Programs. Erie has 13 locations spread from Lake County down through the North Glendale community of Chicago. We are a federally qualified healthcare center. We do have dental services, but not inside any of our elementary or high school sites. So in our school health program, we have 3 high school sites, which only serve the students of that particular high school. They're located pretty far inside the building without external doors. And then we have 2 elementary school sites who have external doors, who also serve the community by separate entrances. And uniquely, we also have a freestanding adolescent health center. It's one of the oldest longstanding health centers in the Chicago area. And we see teens from wherever location. I've had teenagers who've moved out of state who still come back to see us from places like Ohio. And one young lady even visited from the Canadian border outside of Detroit. And whenever she would come to town, she would come over to say hello. So we have, next slide, please. We provide primary care with comprehensive services, and some of our students in our school health center, we are their primary care providers. For some people, we're like the urgent care or extra care. We also have comprehensive programming, including behavioral health and case management, health education. We do a lot of outreach in the community, and we have 3 family medicine residencies and just launched an advanced practice nurse fellowship program. Next slide. I think our response to COVID is best summed up by the metaphor of building an airplane while you're flying it. It's not really the ideal thing that you want to do, build an airplane while you're actually in the air, but it is what we've had to all do. And it's really interesting to just hear your stories from different locations, how you've responded. And I think there's a lot of things that we're just kind of echoing each other. And even if we're taking a different approach, we're all being responsive. Our health centers really had to turn overnight into telehealth platforms and video visits. We had to update our electronic records, and then we had to figure out how to best monitor our patients and families while we were told if they had COVID symptoms, they should take care of themselves at home. We were able to put together some resources to do things like COVID care packages for families who are experiencing COVID, with masks and pulse oximeter and instructions about how to, like, how to stay safe in your home while one person may be in isolation and everybody else is in quarantine, and just what that means. Many of our school health providers actually jumped right in to be part of our COVID response team, taking calls on weekends, working overnights, frequently monitoring our patients to make sure if we heard any signs that they were developing trouble, that we would be sending them to the emergency room. We've had to be extremely adaptable, moving from these like phases and using new models of care and new platforms, and what works and what doesn't with video conferencing. Sometimes, just working from home and keeping ourselves safe and healthy. Initially, we kind of put our whole healthcare team into 3 groups where we did 2 weeks. So group A did like 2 weeks of telehealth, and then they went into 2 weeks of well care, and then they went back to 2 weeks of telehealth. So if they were around a sick patient in the clinic, we'd have at least 2 weeks just to monitor their symptoms to make sure that they weren't spreading the virus. And then we developed a model of telehealth, well care, and urgent care, and separated some of our clinical spaces into those models. We've had to be extremely creative, looking at internal and external resources and partnerships. My husband, I thought it was funny that, like, the most dangerous place to go right now is a bar. And my husband happens to be a home brewer, an avid home brewer. And he actually traded his barrel-aged Russian Imperial Stout for face masks. I mean, we've just had to, like, come up with really creative ways to keep ourselves healthy and safe. We've had to learn as we go. I mean, every day I feel like I learn something new about the COVID virus and how it presents, and how it masquerades as it can masquerade as a cough, or it can masquerade as a gastrointestinal problem. And then, as school providers, our kind of back to school thing is always like, well, let's get all those kids their sports physicals. And now we're finding that, like, maybe some of these young people who've experienced extreme COVID like illness may have lasting cardiovascular issues, or memory impairment and learning. So we're just, again, learning as we go. We're also trying to stay connected while maintaining social distancing, which is really, really difficult. I think it's hard for ourselves, our staff. It's definitely hard for our families. But we've all, like, taken, I think, I feel like the healthcare community is all on board for doing whatever it takes to keep our community safe and healthy. We've also done things like, put into our assessments a social determinants of health assessment. At every visit, we ask our patients, how is it going? How are your resources? Do you want someone to reach out to you to talk about how you're paying your utilities, your rent? One of our former relationships was with a medical legal partner who frequently took a lot of referrals for our patients on these types of things. And she is now the kind of like the voice of what's happening with people who are facing evictions, and how we're going to see some of these rippling effects of COVID into our community in terms of unemployment, in terms of housing, and what is safe housing. Next slide. So in order to look at our new world, we've had to also develop new processes, mostly around safety. We've had to develop our safety security plans to make sure that people coming into our clinic are safe to come inside by screening them at the door. So our PBA, our front desk people, here is Annabeth hiding behind plexiglass and 2 layers of PPE. She's also going to be responsible for asking those patients to make sure that they're wearing a mask. In the past, we would, we're a community health center, we'd have sometimes the whole family would come in for that school physical, and now we're asking that only one adult accompany a child, or that if it's an adult patient, that they also present without any visitors in our healthcare space. We've also had to kind of figure out how are we going to keep safe with separating sick visits from well visits in the school health model. One of the things that we talked about was maybe arranging those well visits earlier in the morning when the center is freshly cleaned from a deep cleaning the night before. And then if there were patients who are experiencing any type of respiratory illness, that we would separate them until later in the afternoon. When we were thinking that Chicago Public Schools was going to be in this hybrid model, one of the things that we looked at was creating almost a team approach of a administrator, medical assistant, and provider who could then spend a couple of days per week at each site, while also providing perhaps some telehealth visits to just maximize our time and effectiveness and impact. We've looked at hybrid model of care, having a telehealth visit and then identifying who needs labs and vaccines, and providing those lab visits and vaccination visits off-site. It's just it's a changing world. It's a changing environment. We have to have a plan A, we have to have a plan B, we have to have a plan A and B. And I feel like, if anything, COVID has really tested both our ability to look at, running kind of a sprint and a marathon at the same time. And then I just wanted to reiterate that importance of self-care, because we are really, we're human. We have to take care of our own stress. We have to make sure that we're sleeping well, that we're eating healthy, exercising, meditation, mindfulness, and spending time in nature. So I really want to thank everyone today for all the really insightful, I think, tips that we've shared with each other, and also to the Alliance and Health Choice Network for allowing us the space and time to come together to share. So thank you.
Thank you, Martha, and thank Erie so much for all the work that you guys do there. And I want to thank everybody for joining today's COVID-19 webinar hosted by Health Choice Network and Alliance Chicago, Back to School. So there's more to come on this. We don't have all the answers. I think as many of our great presenters highlighted today, we're all in this together. Self-care is so important, and keep learning, innovating. But most importantly, as we can see on this next slide, is we are going to be getting together in the future, in the fall, in November. So we want me to save the date for a virtual conference, virtual educational conference hosted by Health Choice Network and Alliance Chicago. Better together, innovating now for tomorrow. So soon we'll be opening up registration. This is the first time that both networks have jointly done a conference, and both times that we've jointly done a virtual conference. So we hope to have your attendance at that. Remember, it's the day after November 3rd, which is the day that we all have to have our mail-in ballots into the location of where we vote, or vote in person. So don't forget to vote. So again, on behalf of Alliance Chicago and Health Choice Network, next week is National Health Center Week. Hopefully you're doing something within your health center besides just seeing patients, which is the reason why we get up and go to work every morning. We want to thank you for all of the work that you do, and our healthcare heroes. So as we close today's webinar, we want to thank you. I know we went a little bit over. The webinar is, as always, recorded. We will send out the recording of the webinar and also the slides to today's webinar. So I hope everybody stays healthy, and we will see each other soon, and have a great day. Bye.